The care and treatment of a terminally ill family member can be overwhelming. For families in need of assistance, hospice volunteers are often the remedy.
Hospice is a very specialized level of care for patients that are dealing with end-of-life illness. Typically, their prognosis is about 6 months or less. And historically, hospice care has been provided at home. But sometimes the care is too complex and patients do need a place to go, and their families need a place for them to go. What we did is we recognized a need, that there were patients in the hospital that were too sick to go home, but they could benefit from the care that hospice provides. And that also we had patients at home that needed the specialized care that could only be provided in a hospital setting.
One of the advantages to hospice care in the home is that the patient is already in comfortable surroundings. That element is taken care of here in the hospital by providing a relaxed, familiar setting, not only here in the family room, but in the patient rooms as well.
Each room has draperies like you might see in a home, floor lamps instead of a table lamp, quilts that hang on the wall. There's pictures on the wall that portray life because really hospice is not about dying, it's about living. And we want every patient to live every moment to its fullest.
This is Cooper.
Inpatient hospice affords some rather unique ways for patients to live every moment to its fullest.
We have pet therapy, where we have pet therapy dogs that come in and through touch, patients' symptoms such as anxiety and stress are relieved. We have a harpist that comes and plays. You can see the response from the patient where they start to relax.
But of course, the most important part of hospice care rests in the caring hands of hospice workers.
The clinicians, the nurses, the social workers, they start asking patients and family members, what are your wishes? How would you like things handled? Sometimes people have not had time to have those discussions.
That assistance proved to be an invaluable aid for Tim Cobb and his family. Tim's mother, Mildred, recently passed away following complications from pneumonia. The time spent in the intensive care unit was stressful, and when word came that there was nothing further to be done for a cure, a helpful nurse had the much-needed message of care.
That's when he introduced us to the hospice idea and said that the hospice personnel will come in and will keep her comfortable.
That allowed Tim to focus all of his attention where it was needed most.
I could stay right by her side. I could talk with her. She couldn't talk to me, but I know she heard me. I could see the eye movement, and not having to go out of the room constantly or not having to show stress to her, to be able to say, Mom, everything's taken care of, everything's going to be fine, and to be able to kiss her forehead, talk with her. It made it all acceptable and something I could handle.
Hospice also offers grief counseling and tends to the last wishes of both patient and family. For Tim, that help means more than words can say. You see, his mother was a registered nurse for 60 years. Helping others was her foremost thought, even to the day she died.
My mom's last act of compassion was to donate her body to science. And they made the contacts and they took care of that transition for me, so I didn't have to do that.
For these caregivers, helping patients and family members gain some control of decisions while facing an uncontrollable outcome is what hospice is all about.
More and more people are saying, I want to have a say, I want to be involved, and I want folks that understand what I'm going through to be able to help me make those decisions and talk about that with my family members so that I'm surrounded by people that I want to be surrounded by in an environment that is peaceful and comfortable and is fostered with dignity. That is, to me, what this environment provides.
For Smart Medicine, I'm Rod Starnes.
Joining me now is Palliative Care Coordinator Debbie Purple. Debbie, thanks so much for joining us.
You're welcome. It's good to be here.
Tell me why living wills are so important.
A living will is a set of instructions or a document that you write down or record the kind of medical care that you want for yourself in the event that you have a serious illness or a life-threatening terminal disease. So in that document, you can choose someone to speak for you when you're no longer able to, that can follow your wishes.
And you have to make certain that the person that you assign this project
Absolutely.
to wants to follow out.
Absolutely. So you want to choose someone who you know is going to honor your wishes. You know, sometimes a family member might say, well, gee, I don't want to lose Mama. I want to keep her here, and they'll do everything. That may or may not be what you want. So choose someone that you think will honor your wishes.
Tell me what can happen if you don't have this.
Well, if you don't have one, then everyone's guessing, and that means that someone has to make that decision, whether it's the doctor or a family members, and sometimes they don't always agree. So you might have things done that you've said you've never wanted. So it's important that everybody knows ahead of time.
I know I had this done 10 years ago or so, and then I had it updated, and the language changes.
Yes, it does. There are some great websites that you can go to. One of them is putitinwriting.org, and if you type that in, it comes up to Advanced Directives. It's a wonderful site that gives you all the medical terminology. It gives you the forms that you can download and fill out according to what state you belong in or what state you live in.
Is a living will done here in Tennessee recognized everywhere?
Not necessarily. Some states do not recognize other states, but they do. It does still state your wishes. Now, Tennessee does honor any other state's living will as long as it's filled out according to the guidelines of that state.
Debbie, thanks so much for joining us.
You're welcome.
Very, very
You're
important
welcome.
information.